Hi, my name is Wagdi Talat. I am a FAMER Global Faculty, a short-term WHO consultant in health manpower development, and the founding head of the Medical Education Department at the Faculty of Medicine, South Canal University in Egypt. This video is about the general requirements for adopting problem-based learning or PBL. There is a plethora of literature on curriculum development in general. On the contrary, a few were published about curriculum development in PBL. Curriculum development models can take a deductive approach or an inductive approach. Deductive models like PBL proceed from the general consideration of the needs of the community, the professional knowledge required, and so on, and move on to the specifics, like identifying the intended learning outcomes or ILOs. Uh, Inductive models start with the actual development of curriculum material derived from the different departments uh, and proceed to more global aspects of the curriculum. Please notice here the difference between identifying the needs in the deductive approaches and the identifying the demands in the inductive approaches. Many questions jump into our heads when we start developing a PBL curriculum. Like what? Like the following questions. What are the essential national health needs of our community that need to be addressed in our program? How could we prioritize our community health problems and how to incorporate these problems in our PBL curriculum? What is the desired graduate profile? What are the general aims or objectives of the program? What are the competencies, uh, including knowledge, skills, and attitude to be developed? What are the values that need to be addressed in the program? For each module, what are the specific learning objectives, topics, and its translation into educational activities? How do we align the objectives with the selected problems for educational use? What is the assessment structure that suits the PBL educational strategy? How do we coordinate, monitor, and regularly make the necessary reform in our dynamic curriculum? How do we evaluate the effectiveness of the course or program evaluation? What are the physical, human, technical resources needed for implementation of a PBL curriculum? What sort of vocational training that both faculty and students need to be able to proceed with such PBL curriculum? What kind of environment is suitable for adopting PBL? As you can see, a lot of questions that come to mind when we start uh, developing a PBL curriculum. In this video, I will try shortly to answer some of these questions. And to do so, I would like to show you some slides. I will begin first with uh, a trial to show you the difference between teaching and learning. Because in teaching, usually the students, as you can see, are following their teacher. They are looking down. Uh, they focus on following strictly um, their teacher. They trust him or her very much. Even uh, if the teacher will take them to um, an undesirable destination or undesirable outcomes. This is in contrary to this picture here in learning, where the students and their tutor walk together through their courses. They talk to each other, their heads are up, they are very self confident. We intentionally put them in the driver's seat in the class tutorials so they become responsible for their own education. Um, they can reach very updated knowledge online. Um, Sometimes they come with more updated knowledge than the teacher himself or the faculty or the facilitator himself. The facilitator inside the class is not um, required to deliver any direct information, but the facilitator only um, guide the students to achieve their own objectives in, in an indirect way. So the tutor plays a subtle role, uh, try to give chance to the students to run their own education by self and group learning. The second issue here is integration. In PBL, during planning of the course, the faculty integrate the different disciplines together. Um, and this actually fits in Hardin's integration ladder in the 10th level here, which is called interdisciplinary level. Sometimes we call PBL schools interdepartmental schools or interdisciplinary schools because there would be a lot of work interdepartmentally and in an interdisciplinary way because of this integration. Uh, so as you can see, the faculty here are doing this type of integration during planning of the curriculum. But if we go up one more step, we will find this level, which is called transdisciplinary, where the students themselves, during their field work, do the integration themselves. That's why in community-based education, it fits in this highest level or the 11th level. And this is the relation between the problem-based learning and community-based education. In integration in PBL, we do horizontal and vertical integration, horizontal integration between the different disciplines, whether basic or clinical, if this triangle represents the basic sciences and this inverted one represent the clinical and behavioral sciences. During planning or constructing the problems in the early phases of the curriculum, we put this much of basic sciences in the scenarios or in the content of the problems, and just this little bit of clinical and behavioral sciences. Going up in the curriculum, we increase the dose of clinical sciences till the end, where most of the problems are very clinically oriented, but with some basic science element in these problems. So this is the horizontal and vertical integration between basic and clinical, but also we have this sort of spiral approach where um, some problems, some priority problems keep coming back to the curriculum, but with different depth and from different aspects. This is the spiral integration. Uh, so in deductive curricula, the planning of the curriculum start from the objective pole, like this. So in PBL, we start with the objectives, and then the objectives fan out to other levels, and we structure our curriculum from the objective side. Versus what? Versus the discipline-based curricula, where every academic and the clinical department plan its own syllabus and then deliver the syllabus to the curriculum from each of the department. And then we come up with like 20 or 30 curricula, not just one curriculum. It's just that we add up the syllabus of each of the department from the discipline side versus the integrated curricula that start by the objectives and from the objective side, like this. So if we adopt an objective oriented curricula, we start with the general objective of the whole school. We call it institutional objectives that fan out like this to the level of the intermediate objectives. And from the intermediate objectives, we start to divide them into the level of very specific objectives that come like in hundreds of specific objectives. From these specific objectives, we group them into what we called preset objectives for each of the problems, which are selected in the order of priority according to the priority health problem that we will talk about in another video. Uh, Usually we stop here, but for those who need to further analyze their curriculum discipline-wise to see if there would be some major gaps or overlaps in some of the basic science, basic knowledge of some basic or clinical sciences, we can do that through computer programs by coding each of the disciplines inside the learning objectives of the problems. Like we give the anatomy A, so each A in each of the problems, they are gathered, and by we push one button to know the whole content of the anatomy and whole content of biochemistry, whole content of surgery, and so on. So this is one type of designing PBL curricula, and it's published by Suez Canal University and the Annals of the towards Unity for Health network. This is another picture of this kind of curriculum planning in PBL. As you can see here in the anatomy, we know exactly the component of anatomy in all the problems all through the PBL curricula. But when we talk about the planning of the curriculum itself, we never plan from the discipline side, we plan from the objective side, but we can read the PBL curriculum also from the discipline pole. This is to show you the hard work of the tutor when he plays the role of the facilitator with a group of students who are having different characters, like the joking, the sensitive, the talkative, the silent, the troublemaker, the stubborn, preoccupied, the critical, and sometimes the aggressive. So during the training of the class tutors, they are trained on how to handle group dynamics inside the class. This is a new skill that the faculty, as newcomers for a PBL schools, have to be trained on how to handle group dynamics like this inside the tutorial class. Um, of course, the tutor and the students are handling two types of objectives. The content objectives that's related to the content of the different disciplines, whether basic or clinical or behavioral, and the process objectives. I'll give you example of those process objectives: teamwork, identifying knowledge gaps and formulating learning objectives, following and using the problem solving process to solve the educational health problems. And we will have a specific video for the steps of problem solving. Self and group assessment. Uh, the faculty in PBL plays different roles. Uh, being a facilitator or a class tutor is just one of them. But faculty should be trained on the different roles that they have to play, like being a curriculum or block planner, problem or case designer, class tutor, coordinator. I can't imagine that you can run a PBL system without having coordinators. Uh, Without having coordinators, the students and their tutor may go to the class, they wait for the problem to come, and the problem never comes, either because it has been formulated but it did not reach them on time, or the problem of the week was not formulated in the first place because of lacking of good coordination. Also, one of the important roles is being an assessor, um, not just to assess the students, but also to be trained on how to design exams using the specific tools that address PBL, like modified essay questions, like uh, um, some specific oral exams that we call triple jump, because the ways of evaluation has to go with the ways of education. You can't train your students by PBL, and then when it gets to assessment, you evaluate them through traditional assessment tools. Also, being evaluator or to practice program evaluation, which is very important aspect of successful PBL system. Um, so we thought at the beginning, when we started PBL in the 60s of last century, that if you are having a good problem, well designed and well trained tutor and active students, well trained as well, then you will necessarily have a PBL, a successful PBL system. But that proved wrong by time, because now you should have, in addition, a well designed curriculum, physical resources um, that's adapted to problem based learning, that, like having um, small rooms for the class tutorials, like having a very good internet connection, um, excellent electronic library, so many things that are needed to run a good and successful problem-based learning system. Program evaluation, and by program evaluation we can identify what goes wrong, and then by regular reform we can ensure a successful problem-based learning system. Thank you for watching this video, and for more videos to come.